Well, that's good. I'm glad he's coming behind me. Oh, very good.
Okay, I see it's 10 o'clock time for the meeting. It appears that Gene's still trying to connect.
No. I'm all connected, ain't I?
What'd you say?
The other Jean, Jeannie.
Okay.
Oh, Jeannie Griego, yes.
Jean, can you hear us okay? Jeannie, can you hear us okay?
Yeah, I'm on. I
Okay.
apologize. I can see you guys, but I know you can't see me. I don't have that video option on this particular computer, so.
Okay, well, Jeannie, if you want to go ahead and give us your briefing on the Homeland Security Grant.
Sure, thank you, John.
Uh-huh.
So I kind of wanted to address the Board of County Commissioners for a couple of different reasons. One, I just kind of want to give you an update and let you know where the Homeland Security grants stand, what we can expect in the next year, some of the changes that have occurred, and what we need to do moving forward. Part of that is particularly because Suzanne has been very involved, and so is Trish, in making sure that we're meeting everything that we need to. We have had 2 site visits since I started in 2016. Part of that is because anytime the fiscal agent has turnover in staff that deals with the grant, that puts us at a red flag, and or anytime the fiscal management budget system, the software is changed, then that also puts us at a red flag. But in any case, the Homeland Security Grant helps to support first responders, in some cases schools, but for the most part, it's our partners that respond on scene and or plan for all hazards emergencies. And with the Homeland Security Grant, that comes with a nexus to terrorism. So the grant itself is dispersed from FEMA under guidance of the Division of Homeland Security, and it comes to the state. And there's several state offices, but what this particular grant comes through is through the Division of Homeland Security and Emergency Management. Both of those offices were combined. Initially, the Homeland Security grant funneled through DOLA and was moved over when they did a reorg. So it comes to the state, and then the state disperses that on what they call a regional level. There are 64 counties in the state of Colorado for the Division of Homeland Security and Emergency Management, or also known as DHS-EM. They have that broken down into 9 regional geographical locations, and it's usually counties that are grouped together because they're close together. So for the San Luis Valley, of course, we've got our 6 counties here in the valley. That separates us from what they call emergency management or EMPG funds, which also come from DHSEM, but those are delivered on a local level and usually dealt with by the local emergency manager. And those program goals may be similar. However, their funding is dispersed differently. The program deliverables are different. So part of the Homeland Security Grant covers an umbrella of multiple emergency support functions. There's 15 of those. If you're interested in those, I can provide those to you. The period of performance for the Homeland Security Grant is 3 years. However, we get a different grant every year. So normally what we see are 3 grants open at one time. What we currently have open is a 2017 grant, which closes August 31st, a 2018 grant, which will close the following August, and a 2019 grant. We also have a 2020 grant that's pending. We don't have approval for that. We've put in for projects for that. However, we haven't received the green light from the state. The Homeland Security Grant process itself each year is rather lengthy. It takes almost a year once you get your projects together to actually get those funds. So it's a long process. One of the problems with that is that the notice of funding, also known as the NOFO, that's dispersed every year when the grant funds become available, is done within a 3 or 4 week period. And the turnaround time to have all those projects in, I've seen it as close as 2 weeks to 6 weeks. So what that creates is you have to anticipate almost a year in advance what projects are going to be funded underneath that notice of funding that comes out from DHS. This last year for 2020, that was a little bit problematic, less so for us. We got lucky this last year, but more so for other regions and other states, because the area where they want to see funds spent has been changed. Historically, we've spent, and in the Valley, over, I'd say since 2005, 2006, millions of dollars in equipment. And a big majority of that has been comms equipment, law enforcement, fire, EMS, in some cases, schools, in some cases, county departments. It just depends on that grant year and the funds that were available. However, the shift is moving more towards a cybersecurity focus for airports, focus on infrastructure, with an emphasis in safety and security for election purposes, which shifted our focus, because generally we order a lot of comms equipment, a lot of radios, a lot of DTR radios for different agencies throughout the entire Valley. Luckily, this last year for 2020, we did have a couple of projects. We did have to clean them up quite a bit, but we had projects that qualified under the airports. So I just want to make sure that you're aware of some of the shifting of where the Homeland Security funds need to be spent. Now, more on a programmatic level, the initial bylaws that are associated with the Homeland Security Grant are called the All Hazard Advisory, San Luis Valley All Hazard Advisory Committee. And they were lacking some base documentation. In working with state from the 2 different site monitoring visits, which is what it's called when you get a visit from the state and they look over your books and the program and all the equipment. If you have that happen from a federal level, that's called an audit. But essentially they're very much the same, regardless of the terminology. And what they found is that the bylaws for this group that helps hold both the program and the funds together needed some a very serious overhaul. And Suzanne and Trish have been extremely diligent in seeing that through. And it's been a very timely process. We've had to put together an IGA, which your county attorney has approved and has gone out to some of the other counties. Either I can provide that if you'd like to see what it looks like, or I think Trish has access to those IGAs. And really that should have been the base document that was formed as an agreement between Rio Grande County as the fiscal agent, along with the different BOCCs within the all hazards region or the 6 counties, so that there's an understanding between what the fiscal agent does and the interaction between those and the other counties and the agencies within those counties. And so that's been a big, big plus for us. And I think we've received a few of those back that have been signed, but we really need those region-wide so that the agencies in those counties can participate in the Homeland Security program and in the grant. Do I have any questions so far?
I don't.
Go ahead.
No, I said I don't have any questions.
Oh, I'm sorry. Okay, so I'll move on then. In addition to that county level IGA, we're working on developing an agency IGA, and then that ensures that the process between whatever agency that's awarded a project for that year, that understanding between what the fiscal agent does and what's expected of that agency or organization is in place before money ever starts to move to support that agency or organization's project. In addition to that, there's the 2 CFR 200, and that kind of the super circular, and it helps better put together and streamline the federal requirements for all federal grants. One of the big things that came out of our site monitoring visits, not only the first one, but the second one, and I know we've had some turnover in the last couple of years there in the fiscal office. And in the second visit, what we found is some of the local policies and procedures that should be in place for Rio Grande County in order to meet those 2 CFR 200 federal requirements for all grants, not just the Homeland Security grants. We had some holes there. And Trish has done an outstanding job with putting those together, putting them before you, and making sure that not only are we in compliance for the Homeland Security grant, but that also puts you in compliance with any other federal grants that you're working with. One thing in particular about the Homeland Security grant is it's heavy on the back end. And what I mean by that is you'll see, I've worked with multiple grants since 2005, and you'll see grants, you spend the money, great, it's all gone, no one ever thinks about it again. Homeland Security comes around on the back end. They want to see the paperwork, they want to see the POs, they want to make sure that whoever the fiscal agent is has their own local policies and procedures in place that support the federal grant. And there's a huge aspect to the inventorying and the tracking of the equipment that's been purchased and or training funds, because the Homeland Security grant not only focuses on equipment, although that's a lot of what we buy. The whole idea is to plan, train, exercise, and support the locals so that they have a better regional capacity to meet Homeland Security objectives, if that makes sense. And so we've come huge strides in the last couple of years. We've been recognized for our training and exercise plan as one of the best in Southern Colorado. Our process and the application that we use now to screen applicants for projects, I've been asked to give presentations before state, and the state uses that as a model. not only because we change it every year and update it so that it matches the notice of funding, but also the format matches. So when you have to take the paper documentation and upload those projects into the state system, all of that's organized and in line. The other thing we're doing is we aren't the only ones that don't have the IGAs in place that we needed to from the start. And we're actually helping in our process, even though each region is different and functions differently. So the folks that we have to work with on the regulatory side for the state for the grant, it's actually helped them better understand how us and some of our neighboring regions work and how to sometimes better implement or get to the place where you have the IGAs in place. That way, with the Homeland Security Grant, our T's are crossed and our I's are dotted. And as Suzanne makes her way out, I want to make sure that we have the representation that we need from the Rio Grande County BOCC for the Homeland Security meetings, which are really the All Hazards Advisory Committee meetings and those Board of Director meetings. The Board of Directors is who decides or makes the recommendations as to how the money is spent. And ultimately, because Rio Grande County is the fiscal agent, because they take fiscal responsibility, the Rio Grande County BOCC is the final say for how those funds are spent and how the grant is administered. And that's extremely important. It's important for our partners in every county and for the other county BOCCs to understand. And I just want to make sure we're on the same page as we move forward and as Suzanne goes on and to do bigger and better things. I wanted to give a real brief update on the 3 current grants that are open and the dollar amounts that were allocated for those and the percentage completion for those grants. So for the 2017 grant, we were awarded $151,945, and that grant's 95% complete. We recently acquired a grant change that's going to enable us to spend that other 5% and to be closed out by the end of August. The 2018 grant was awarded $154,772. That grant is 85% complete. And the 2019 grant was awarded $166,667, and that grant is 48% complete. The 2020 grant is estimated to be the same as the 2019 grant, although we don't have official numbers yet, and that's estimated to come in at $166,667 as well. Questions, please.
Well, Gene, you did a good job of explaining. Let me go back and check my notes here and see if I have a question. What's the status on the IGAs? We still have some that need to be completed with the different counties. Is that correct?
That's correct. So Tricia sent those out twice, and the first time was right before COVID hit. The second time she and I sat down, we followed up, and she sent them out again. I think she's received back to Alamosa County and also, I want to say Castilla County. I'm not sure if she's received any others. So we still have several counties. She's shaking her head no. So we still have several counties out there. And really, we need that so that, well, they need it more than we do. But as a regional program, and you guys as the fiscal agent, we want to be able to engage the valley as a whole. However, what we learned in working with the state is that if they don't sign the IAGA, they are not agreeing to the terms that Rio Grande County has set or that the state has set and what needs to be in place. So it's a choice that's up to them. But in Alamosa County, just as one example for them, they're looking potentially, I want to say between $64,000 and $69,000 in equipment for the regional airport there in Alamosa. And so if they decided not to sign the IGA, they would forfeit that, and that those funds would have to be spent elsewhere. So it behooves each county to go ahead and sign that IGA, and or if they've got questions, to follow up with Trish. Moving forward, oh, I'm sorry, go ahead.
You said that the emphasis is moving from equipment to cybersecurity for things like airports and elections. I assume that's for the 2020, or does that also include the 2019 grant?
So it excludes the 2019 grant. It's 2020 moving forward. From what I've seen so far and heard from the state, we can anticipate those types of funds to stay in those types of categories. An example is airport security, things that support security around election locations, ballot boxes. There's other things. There's 4 main categories that come out of the notice of funding that outline what those areas are, and kind of some examples of some of those. I can share those with you if you like. I can send those via email. However, we've primarily spent a good bulk of our money on radio equipment, whether that be handhelds, dash mounts, repeaters, things of those nature. And at this point, Homeland Security, that would be kind of a second tier, really what they're looking for as projects in these other areas. And so it's a little bit of shift for us, although we were lucky enough to kind of already be moving in that direction.
If you could send out those that category list, and can you give me an example of what an eligible project in an airport would look like?
So for 2020, what we're looking at for the regional airport in Alamosa, they're doing a lighting upgrade throughout the exterior portion of the facility. You could also do security cameras, different types of safety measures, locking mechanisms, in some cases credentialing, depending on what it is. Each program or each project is kind of specialized to itself, and depending on what the components for that are, depend on whether or not it's eligible. The state will say it depends in many areas, and sometimes they're the deciding factors, and so it's hard to know what they're going to approve or not approve. So really it's kind of on a case-by-case basis, but we have a general idea of the areas that we have to work towards.
Are there cost shares on these programs? For instance, if they do the, what was it, $60-some thousand to the Alamosa Airport, is there a cost share? And if not, it looks like they're taking up about 45% of the total grant budget.
So there's not a required cost share. The board of directors can implement that themselves. The one, and sometimes it's a good thing, but the one thing to caution would be is if they say now, yes, we can do the cost share, it's 20%. Then we get down the road a year later when the money comes in and something happens and they can't make up the 20%, then you're scrambling to find a way to spend those funds. And because there's not a required cost share, at least at this point for the Homeland Security grant, it just depends on what direction the board wants to go.
Is your salary covered out of the grant?
Yes, it is.
So, and going forward, Alamosa County could take up a large chunk. The administrative cost would take up another large chunk. So there'd be a fairly nominal amount left over out of the 20 grant for other projects.
Yeah, for the 2020 grant, there really wasn't a whole lot outside. There was another project that went to Blanca PD for, it's not exactly a CAD system, but it's a communication system for police departments. Everything they were doing was pen and paper. And so this actually puts them on the map for some of their paperwork as far as their calls, their responses, and how they're recording and tracking those. But yes, now initially, when we looked at the projects that they came in, I don't think anyone was planning on spending that much in one particular county or in one particular project until we got the notice of funding. And once we got the notice of funding, the state said, if you have these types of projects, you have to prioritize them here in this area. And so a lot of the other projects, the more traditional, we'd like 5 radio, 10 radio, 20 radio projects, had to come secondary in order to prioritize what we had to with the change in the notice of funding and the direction that DHS wants the money spent.
Okay.
And if I might make a comment, John, is those projects are selected by the board of directors at the beginning of the grant cycle. All the applications come in, they're selected by the board of directors. And so all of the 2020 grant the projects have already been selected.
Sure, I understand that. And
Okay.
Since the Alamosa Airport is our one regional airport and it has these security needs, it certainly makes sense that you would prioritize it that way. And then sounds like Blanca was still in the Stone Age, and so this helps bring them on, kind of updates and modernizes them. I wasn't questioning how the money was spent. I was just kind of questioning how that process worked. And so in 2021, then when we go through that process, there'll be other priorities. I assume some of them will be somewhat mandated by the terms and conditions of the grant, the types of things you focus on. That all hazards, or whatever you call that particular committee. She said that basically it's the all hazards group with the board of directors. Is that correct?
Yes, that's correct, John. Go ahead.
But the board of directors is the one that makes the decisions on the grants.
Right. I got that. Yeah. I mean, I think I got it. But it sounds like a fairly defined process, and it sounds like we've been doing a pretty good job with a couple of the holes that Trish and Jean and you, Suzanne, have been working on. We're moving along. Is there any reason why the other counties would not want to sign on the IGA at this point? Can you think of any? Trish, I see you unmuted.
Yeah, from what I gather is, have the administrators contacting me. They haven't been part of these conversations at all, and they're confused. I've explained it. I think one of the biggest problems is merely because there was one commissioner per county when it was explained. That's the board of directors, and that commissioner neglected to go back and explain it to the other two. So I'm playing a little bit of catch up with the administrators now so they could explain it to the commissioners as a whole. Like Jeannie said, it was really bad timing. It was like, board of directors all received this. We sent out the IGA, bam, COVID. So many months have gone by and we're having to re-explain it.
Is there a time limit on getting them on board or them coming on board?
I suspect we're going to get them on board the moment that their entity is waiting for the money and they realize that they need that signed in order to receive it. So I'm not too worried about getting it. I do think that Suzanne, Jeannie, and I should revisit with the board of directors and do a reminder so they can go back to their board and explain it fully.
But is there a drop dead date for these counties at this point?
When does the money come in, Jeannie? Do you know when?
For the 2020 grant, we're anticipating it anywhere between the very end of August and December. It's usually in the fall. When we get the funds, it's never the exact date it was the year before, just like the notice of funding comes out in the spring, but there's never a specific date. And I want to thank Trish for helping to facilitate the IGA process. Something additionally that we'll be doing with the 2021 grants will be that as part of the project application process, unless the Rio Grande County BOCC or fiscal agent feels differently, I feel very strongly that anytime someone goes to submit a project application, that they have to be able to submit or show that their county has signed the IGA, which means if agency Carmel Fire Department in Conejos County says, hey, we want to put in for this project, but we haven't received the IGA from Conejos County, that means it's a no-go. Otherwise, it's a huge waste of time for myself and everyone else without that IGA. So as part of the project process and getting those projects in from the Valley from 2021, I don't really think that we should move forward on any project whose county hasn't signed the IGA. And if we have outstanding counties, even at that point, it'll help facilitate that process. And that's part of the reason I think why for the 2020 grant, Castilla County and Alamosa County have already signed them, because they know that they have projects pending for the 2020 grants, Blanca PD in Castilla and the regional airport in Alamosa.
Has the 2020 grant been fully allocated with counties that have submitted IGAs?
What do you mean by fully allocated?
Well, we had $156,000. We're talking, I guess, let me back up. The Alamosa and Castilla projects, those are 2020 grant requests. Is that correct?
Yes, the grant requests. Now, they've been through the local process. They've been given to state. And we haven't heard back officially in writing from state in the form of a grant agreement that's been signed. Now, tentatively, go ahead. So
of the $156,000 and change that we're anticipating for the 2020 grant, do we have projects already proposed that basically use up all of those grant funds with counties that have signed the AGA?
Yes, and to the dollar. There's a lot of planning that goes into this, and then usually on the back end, right before the 3-year period for any grant ends, we usually have to look at that planning process, look at the funds available, look at how the projects have shaken out. Sometimes you'll have projects where you have $5 left over because they got an additional discount or the price has changed, and then you have to turn around and do a grant change. But for the 2020 grant, everything that needs to be submitted to state at this point has been submitted to them, and what we're waiting to hear back is we're looking for those official numbers and that official agreement. That agreement is signed by the chair for Rio Grande County BOCC.
Now, for the if the other counties don't sign on for the 2020 grant cycle, does that preclude them from coming in for the 2021 grant cycle?
No.
So there's really no incentive for them to get on this year because the funds have basically already all been allocated.
In a sense, yes. However, if they're looking at participating in 2021, those counties are going to want to have that signed.
Well, it gives them a seat at the table, I assume, at that point.
I'm sorry, say that again.
it kind of gives them a seat at the table as we go forward into the 2021 grant cycle.
Yes, yes, it does.
Okay.
And this is a new process for them. They haven't seen anything like this since the beginning of the program. So we'll see how these changes shake out. It may take them a little bit to adjust.
Sure. Are there any other questions? Suzanne, I know you're intimately familiar with the whole process and have been there with it through all of this. So, Jean, do you have questions?
You know, I would like to be able
Wrong
to.
Jean. Go ahead, Jean.
Oh, the other Jean. Hi,
Morning,
Jean.
Gene. This is Gene. How are you?
Good, sir. I'm sorry. Go ahead.
Hey, I just had one that I really wanted to check on. You said that there was the county IGAs, which I understand what those are. And what was the other IGA you was talking about? I didn't get that name wrote down.
Their agency or organization IGAs. So here's an example. We have the county IGA from Alamosa County. However, we'll also need Alamosa Regional or the regional airport to sign an agency IGA. Because
Okay.
even if you have the BOCC on a commissioner's level that understand their relationship with the board of directors and the fiscal agent, the direct agency that you're working with within that county also needs to have that same understanding of what their roles and responsibilities are and what they are for Rio Grande County.
Okay. And the other thing was the 2019 funding. I got the dollar amount, but I missed the percentage for 2019. What was it?
The percentage completed is 48%.
Okay. Thank you.
And
Okay. Go ahead,
As another-
Suzanne.
as another point of clarification, the reason that would be maybe not 100% is it's all allocated, but it hasn't been completed.
Makes sense. Makes sense. Jeannie Borrego, you started to say something when we deferred to Jean, the commissioner.
I don't remember what it was, John. I'm sorry.
I'm sorry. It's hard to hold those thoughts. Do we have anything else for Jeannie Borrego? Jeannie, do you have anything else for us?
Yes. I just want to make sure as Suzanne transitions out that we have a smooth implementation for whoever it is that's going to take Suzanne's place. The chair, I want the chair to understand when you go to sign that grant agreement, why you're signing it, what that grant agreement is, and to address any questions you have when we do get that 2020 grant agreement. And just to make sure that we have someone that's aware of the grant, that's somewhat familiar with some of the requirements, and can participate in the meetings like Suzanne has done.
Great, thank you. I know Suzanne's done it because she's had to leave some of our meetings to participate in the all hazards meeting. It's been a priority for her. And clearly this is one of the programs we have out there where there are measurable benefits that I can see. So thank you. If there's nothing else, Jeannie, we really appreciate you taking the time. I think this was a good, clear explanation of what's going on and where we are, and I do appreciate it. Is there any other comments from anybody else on the call?
Thanks, Gene.
Thank you. Appreciate your time today.
You bet. Thank you so much. Well, that took up 3 pages of notes right there. The next one is Cynthia Ford. Is she on? I don't see her.
Cynthia wasn't scheduled to come, that these are conversations with Tony, these next ones.
I'm sorry. Okay, so is Tony supposed to be talking about the HCC coordinator contract?
Correct. That was the original plan when this was put on the agenda. We have had a little bit of a snag. It was supposed to be discussed after the HCC steering committee. The HCC steering committee did not actually discuss the contract nor the budget. So we can still discuss a little bit as Tony feels necessary, but we were relying on that steering committee to make decisions that is now scheduled for this Thursday.
That steering committee meeting and discussion is scheduled for Thursday. Is that correct?
It was last week, but they did not achieve what they needed to, and it's now been moved to next Thursday.
Okay, thank you. Tony, do you have anything on this for us right now?
The only thing that we were able to really agree on at that meeting is that they will be looking at bringing some adjustments to that budget. So we'll need to talk to the program manager, Kurt, at the state to see if those adjustments could be approved, and then bring those back to you guys to see if you would like to officially accept a new budget and put that to the state to see if we can make some changes. And that would include potentially the stipend lines, to add more detail to those or give specific ties back to the statement of work and deliverables. And then it would also likely include a change to Cynthia's contracted amount, which they're going to discuss and bring a recommendation.
And that's for the grant that began July 1st.
Yeah.
So it's just this current fiscal year's grant.
Yes.
Okay, thank you. That's the 2021 fiscal year grant, right?
We're in fiscal year 21.
Thank you. Is that all you have on this?
Yes.
Are there any questions from the commissioners on this?
And that was a 5-year grant, correct?
I believe, I'm not actually sure which year of it we're in right now. I think it might be 3.
That was going to be my next question.
Okay, thank you. All right, well, I guess we move on then to the protect your neighbor discussion. That'll involve Tony and others. I had a call come in during the SLV BOCC meeting, so I missed a good part of this whole discussion. And it's my understanding that the SLV BOCC voted to work as a region on the protect our neighbor standards for all of us. So I assume that we're going to start the discussion at that point. I don't know who to open it up with. Tony, why don't you start, because you're probably in this as much as anybody.
Sure. So let's talk a little bit about our regional effort. And I think that'll help the conversation of how we're going to go forward regionally. So you're aware that Rio Grande County has our own emergency preparedness funding through the state. And that allows us to do planning. It funds part of Diane's time. It has funded part of the director's time. And that grant they did offer some flexibility once COVID hit that allowed us to move those efforts into a COVID response. So that funding was able to be used for some of our COVID response. The EPR grant regionally is a larger entity. So our emergency preparedness effort regionally is hosted through a different county. That one's not ours. We're not the fiscal agent for that. And that allows us, it's Alamosa. And that allows us access to an epidemiologist and some coordinators and some of that expert level information that we don't have here in the county, and that we don't actually have a budget for either. So before COVID, what that meant was that these groups can all come together and plan for a pandemic, for an emergency, using the FEMA model so that we have an official response plan. They were able, as soon as they moved into the emergency, they were able to say who's in charge of what pieces almost immediately, who's doing our communication, who's doing our response, who's the logistics, who's the planning, because that's what that process had allowed. So this bigger group of emergency preparedness planners, they were able to start that regional response to this right away. And now that we've moved into the response, we have been daily relying on these experts to help to advise, to help to track, and to help to communicate, not just with the public, which I understand there's been some questions around, but also with the state and the experts at that level. Because like I said, we don't have the capacity here, not only the expertise, we actually don't have enough people who could do it if they knew how. So we don't have that right now. So the move to protect our neighbor requires, I went ahead and sent this sheet to y'all. It has the matrix on it. It's in your emails now. I sent it while Jeannie was speaking. The move to protect our neighbor has certain requirements that we've got to meet one time. So there are check boxes that we need to meet. And then a part of that is to also have a plan in place if and when we are no longer qualifying for that item. So we have to have a mitigation plan in place for when we have too many positives to qualify, or we don't have enough PPE to qualify, or whichever the measure is, we need to have a full plan in place to address that. Some of those items are going to fall to that regional level. So without that expertise, we're not going to be able to have a strong enough mitigation plan to qualify for protect our neighbors in the first place.
Does this change the, or does it shift some of the authorities to the regional group then?
I'm not sure. What maybe kind of what are you worried about the authority of?
Well, I'm going to have to speculate here.
Sure.
Let's say that one of the counties has a major outbreak and it skews the numbers for the whole region, but it's specific to that county. I heard Helen Sigmund say that COVID doesn't know any county lines, and I agree with that, but we do know that some counties have been more susceptible than others. So if we have that, if one goes down, do we all go down and revert back to safer at home?
So that was part of the conversation Friday. It would be something that would be included in the request, is working through how do we determine when that box is no longer checked? Is it all the counties? Is it some of the counties? But that's going to be a part of the process going through. And as was also discussed Friday, ultimately each of the counties are going to have to sign off on it. Not just because of an agreement regionally, but also because that's a requirement for the application for certification. So.
Well, as I understand it, under Protect Our Neighbors, each county could make their own application, but the state would prefer not to deal with that.
We would be able to make our own application. I don't think we have the capacity to make an application that would pass.
Okay.
We would be able to do that. And also, as the rest of the region is going in together, I think we would have to have a very strong and science-based reason to opt out of that.
But so far, we've had difficulties with the regional structure and some of the things that they've done, partly getting accurate information to the counties in a timely fashion, among other things. I mean, there's been an ongoing conflict between the emergency managers at the regional level and with the public health people that are functioning at a somewhat regional level right now. How do we address that in this agreement to work together?
So I can't actually speak to the conflict. What I've seen since I've been back on is that each of the 8 o'clock LPHA, local public health agency calls, have had emergency management on them. they've had at least one person on, and that person is shared and been involved in the conversation. So I'm not sure where that conflict stands right now, if there was a conflict between the two groups. One of the items in Protect Our Neighbors, just like I said, the county commissioners are all going to have to sign off on it. So are the emergency managers. So this includes a letter of saying that they support the plan, and that they're committed to following through with each of the pieces of the plan, and that they're going to use their office and agency tools to comply with the plans. So that would be their guaranteeing through submitting that letter that they would be on board with this plan exactly as it is.
Okay.
Okay, I was just looking at the matrix that you sent and just kind of scanning over it really quickly. It seems that we really pretty much meet all of that right now, don't we? Or what are we missing on?
Yeah, so the hospital bed capacity is something that is coming down to math. We're going to have to see what the capacity really is for that, and what the hospitals will guarantee as that capacity. And that will be included in their letter of support. They're required to be on here as well, saying that they agree with whatever that it goes in the application. The PPE supply is a little bit of a concern. I don't know that the 2 weeks is going to be too much to say that we do have that, but as you guys have been hearing on a number of different calls and from different people in the community, the gloves, masks, it's kind of just going through each item will run short and it'll be very difficult to get a hold of. So guaranteeing that we have that is going to be, again, it's going to come down, this is a question specifically for the hospitals, so they're going to have to tell us that that is absolutely true. The rates of hospitalizations in newer cases, those are going to be, one, a question for the epidemiologist to actually track that in a way that we can defend. So those numbers will have to be really consistent. We're up to 7 again right now. I wouldn't think that we would, I don't know that we're going to qualify for that second item for very long. So we as just this county, we may be able to say, yes, that sounds right, but to actually say that it sounds right, and if it doesn't, here's how we're going to fix it, that's going to require a little bit more.
The second item is the PPE.
That's going to be in the 3rd and 4th metrics.
Oh, okay, in that
The
category.
application. Yeah.
Now, the PPE, an opportunity was missed to acquire a bunch of PPE. I believe the Healthcare Coalition couldn't come to an agreement on that, and that's why we had to de-obligate $40-some thousand out of our HCC grant.
I will say for the hospital PPE, they would have required those N95 masks, and we didn't have a source that could have come through fast enough for those. We can have the masks that we need to use here at the county. Now with the mask order, we have had access to those and did order some, but the hospital grade equipment, we wouldn't have been able to get.
Okay, so the hospitals are using N95s, not just surgical masks?
Yeah, they'll need more specific equipment than we would need here.
Okay, but the question is, do they require N95s? Because I haven't seen them using N95 masks.
That's my understanding, is that as the requirement for PPE, it's not going to be just those surgical masks. We need to be able to demonstrate that they have enough of the hospital quality items on hand for 2 weeks.
Well, part of the reason I asked, that picture that came out the other day, Rio Grande Hospital supporting wearing masks. All of the doctors and medical professionals in that picture were wearing surgical masks, not N95s. So as I understand, I have not heard from the hospitals or any of the doctors I've spoken with that they're using N95s.
And it may have to do with the situation that they use N95s when they're around the patients, and then whenever, just for normal interaction, they use the surgical mask or whatever you call those, just simple.
But we don't know that for a fact. We haven't heard from the hospitals specifically if they require 95s.
I can't say. I can say that the requirement to move to protect our neighbor is going to be based on the general accepted use of these things. It's not going to be, if they're wearing bandanas at one hospital, that doesn't mean that they need to have enough bandanas for 2 weeks. It's going to mean they're going to have enough PPE on hand that the state would require.
I don't want to keep picking at this, but you mentioned bandanas. I don't know that anybody in the hospitals are using bandanas. I know that people are in the grocery stores, the general population. I haven't had a chance to read this, Tony, while we've been on this meeting.
Sure.
Do we need more PPE for the general population, or is the general population just use whatever's available?
Yeah, so the mask order is actually a face covering. It needs to cover your mouth and your nose. And that can be bandana, the cloth masks that are being made at home for people, or the surgical masks that we have here at Public Health. Any of those are going to work for the mask order. And that's also going to work in the hospital. Like Suzanne was saying, if you're moving from your office to the waiting room, or you're going to the cafeteria or something like that, you can wear your mask that's required by the order. It doesn't have to be hospital health grade equipment. It can be a face covering.
But the masks that we ordered and received, those are basically hospital type masks, the surgical type masks.
Yeah,
I see
they're
Trish nodding her head, yes. Okay.
they're more of a style. They're not necessarily going to qualify for the PPE for protect our neighbors, but yes, they're the surgical style of mask.
Okay, I'm confused again. I'm sorry. I'm slow
We
processing.
don't have the N95 masks here.
Right, but in the workplace, N95 masks aren't required under Protect Our Neighbor, are they? So Trish had mentioned that I could get a couple of masks for my own use when in the courthouse and all. Does anybody have any idea what the life expectancy of a mask is when we're using it? The masks that we have?
We're going to have to look on the box. They're not meant to be reusable. So we can look on the box. We can hand out more. We're looking at trying to source some more of those masks. It's going to get more difficult as we go through now.
Yes, Trish, go ahead.
So I was able, just before the governor made his announcement, I did purchase 7,500 more masks. They are on UPS right now, so I suspect they'll make it today or tomorrow. But yeah, those aren't made to be used over and over and over again. I mean, those little ear hooky things tend to break fairly often. I think I've gotten about 4 to 5 days worth out of one, just to give you an idea.
Okay. So with the current 1,500, if we gave every employee 10, every employee of the county, we would exhaust our current supply, and there are 7,500 more en route. I assume those are specifically for county employee use?
Yeah, I mean, I didn't hesitate to get a hold of my guy the second I heard this was coming, because I knew we would need more. And so I'm trying to do the math really quick to give you exacts, times 3, 7,200 from the last batch and 7,200 on this, not 1,500. Of course, out of the ones that I just reordered, one specifically goes to DSS that has to be separated and remain separated with the way that the state funds are. So ourselves, we will have, let's see, 4,800.
For everybody else besides DSS. I was counting DSS and the 150 plus or minus employees that the county has. So I was just looking at aggregate numbers. Are these also going to be distributed to the sheriff's department out of this order? That
If
you're
they
receiving?
need, I have been trying to contact them to see if they wanted another batch prior to the governor, and I didn't receive an answer, and I just made the executive session a decision to purchase them. But yeah, I was kind of thinking we'd be leaving them right here in the courthouse and distribute as needed.
Okay, so
And these are non-surgical officially. They do come in from China. They have to be listed as non-surgical when they come in from China, is what I'm told.
right, and as I understand, those surgical type face coverings don't have the same micron filtration that the N95 or KN95 masks have. And so it's my understanding that the COVID virus is small enough that it can penetrate through these masks. And so all we're really gaining is some level of filtration to help a little bit, but not as effective as the N95s.
And I do have access to K95s, but I've been told they're not usable when discussing through the HCC steering committee, that they need the N95s. There's something about the K95s the medical employees don't find
Well,
usable.
the difference between the KN95 and the N95 is the KN95 is a Chinese designation for masks that are very, very similar in the filtration and layers of cloth or filtering, but they do filter at slightly different micron levels. But in the information that I've been able to find, they're very, very close. And I'm sure that we could find somebody at the state, at CDPHE, or somebody at the federal level that could tell us if they are comparable and usable. I'm not sure that the folks at the steering committee really even know the difference, quite frankly. But it's strictly an international designation on the mask, N95 versus KN95. And what I've read from the federal government is they're interchangeable for our purposes.
From the RETAC meeting the other night, the understanding is that the major difference is how they attach, whether they go over your ears or around your head. And there were a lot of people said the KN95s, they didn't like it to start with, but they've gotten to where they like them a whole lot better. And so apparently the medical people are using them interchangeably.
That goes along kind of with what I've read. I didn't know about the different way that they attach, but I do know what I read about the filtration and the efficacy of the masks, that they're very comparable. So I'm here again, we're getting mixed signals from our experts. Does it matter at this point if KN95s are available? Does it matter, or can we find out if it matters?
As far as the protect our neighbor designation to try and get something to the hospital, it would matter. For our use here for the mandatory mask order, really what we're asking for is any face covering. So offering the masks that we have right now is ideal.
Okay, but in terms of the protect our neighbor, and you mentioned PPE being a challenge at the hospitals. Sounds to me like we aren't 100% certain on what the requirements are.
No, that'll come down to the hospital. They actually have to be the ones to say that they have enough on hand, and what their sources or how they're getting that delivered is going to be through them. We can help. We can be there to source if we can, but that'll be a hospital specific question.
And to date, we haven't heard for sure what the hospital capacity is right now at the Rio Grande Hospital.
I don't have an exact number, no. As far as the date or the length of time that they have enough equipment for it, I don't have that.
And that would be Alamosa's hospital, not our own, correct? Because they're the ones that would be taken in the COVID. Is that right? Or is it both?
From what I can see is we would need both of the hospitals. We would need our regional hospitals to meet this qualification.
I think
And
part of
I
this-
know that the hospitals are drastically needing gloves at this time. I've been spending last week and this morning reaching out to the vendors that I know, trying to find those gloves.
Have the hospitals requested that we assist in that effort?
John Montano is the one that contacted me. The hospital has requested that of John. John knows I have a few contacts.
Okay. But I heard Tony say that the hospitals are the ones that have to make that determination. I would assume that locally, I know that Rio Grande Hospital has maintained itself as a clean hospital, but under a surge, it may find itself having to accept COVID patients.
Right.
If we get to that worst case scenario. I would think it would be helpful to have a direct dialogue either between Tony or Trish with the hospital administration to see how they want us to work with them.
Yeah, so they are still communicating with us. We haven't specifically asked yet, do you have 2 weeks of the required PPE? We haven't asked that question. They're sharing out in our LPHA calls and our other calls that they're short on this item or this item. That's where the gloves keep coming up, that they're becoming increasingly harder to source. So it's really a call out to anyone who can assist with that.
It'd be helpful if they were to put that in writing so we had it while we're negotiating. If we do protect our neighbors, or are we going to delegate all of that to the regional effort?
My guess is that as the regional team comes together, we will divide those requests. We have quite a few contacts to make and people who will need to write these letters, and I'm guessing that it's going to take a little bit of time. All of the sheriffs, the local police departments, mayors, and emergency managers are also going to have to do letters. That's in addition to the public health directors, county commissioners, and hospitals. So all of those entities are going to have to sign on to this plan in order for us to move on.
Okay,
at the-
well,
Oh,
good. Suzanne.
Also, at the PTAC meeting, we had the discussion about whether or not the hospitals had enough PPE, and all of the hospitals indicated that they did, with the exception of the gloves, and the gloves particularly in a size medium.
Oh.
Apparently, everything else that they felt like they were in an adequate position on.
Great.
So it's kind of like shopping for shirts at Big R. They got extra larges and extra smalls and nothing in between.
But they would still need to do their certification that says, or I guess it's called a certification, whatever it is, their letter that said that they did have that. But from my understanding, that's not really a huge sticking point.
So we can turn the application in with explanations and let the state know where we are. I don't know which items are going to be a make or break on it, but we'll just go to the best of our ability to demonstrate. Our goal is to demonstrate that the region is first, right now, kind of holding steady, at least with COVID, that it's not increasing, and also that we do have a surge. We have a plan in place, a very realistic plan in place to address that.
So does the county, other than signing off on this and letters of support, do we have to do anything with this checklist, or is that going to be done by regional?
So public health our public health department will be working with the rest of the region to create this document, to create the application.
I understand you'll be working together, but we're not going to have to submit. We're not going to have to complete this checklist. Regional will complete the checklist, right?
Right, we'll all complete it together.
Right. I understand it'll be a collaborative effort, but it'll be submitted by region, assuming that all the counties sign on.
Right.
And at the BOCC meeting, it might have been an expression of intent, but it certainly didn't come to the level of a resolution that would bind all the counties. Each county is going to have to approve joining this effort individually.
Each county is going to have to approve the application, certainly. Yes.
Or even to let regional act on their behalf.
I don't think you're gonna need a separate declaration, or you're gonna have a motion or resolution or anything. You'll buy into this process, or you won't, by signing that letter.
Okay, that'll be a question probably for the county attorney. I'm finding out after conversations with Dennis Hunt that many of the things we do, we actually do need to have a resolution
Okay.
in place. I don't know if this is one of them, but we would certainly want to have clarification on that before we went forward.
Sure. This is gonna take time. It'll be at least another month before there's an application, I would anticipate. Just getting those letters is gonna be a considerable effort.
Right. And so, okay. Is there more discussion on this particular protect our neighbor item? Other commissioners?
No,
Commissioner Glover? Your screen is small until you speak. I couldn't tell if he waved his hand or not. Did he? Suzanne?
I'm good.
Okay.
I know you're good. Are you? Do you agree with us?
Sure, why not? Yeah, I do. I agree.
Okay. All right, then that's it. That takes us to the CVRF eligible funds discussion, business loans. Do we have anything specific on that?
So this was a topic along with the others that you had requested in last Wednesday's meeting to be added to the work session.
And what I specifically requested, I don't know if the other commissioners did, is that we have some information in a readable format that summarizes all of the COVID-related grants that are out there right now and what expenses are eligible, where the overlaps are, so that we optimally use these funds going forward. And that would have included in the CVRF, which I understand may be eligible for business loans / grants. That's kind of a whole discussion on its own, but that has the potential to swallow up a large portion of that money if we decide to go that direction.
And that was the discussion at the last meeting where we added this to the agenda, was about the business loans and the confusion on the eligible funds, the federal guidelines.
Do you have that information for us at this point?
Yep, I had forwarded it to you guys a while back. I can re-forward it if you like. Go ahead and do that right now.
So I've got this in front of me. It does specifically allow for business grants. I think we've talked before that regardless of how much of these funds is put toward that, loans are going to really go beyond our capacity. Grants are possible. I think loans just really go out of what we're prepared to handle. Anyone here on the team?
Okay, I guess I'm not able to communicate effectively on this. We don't know if we're even going to do business grants at this point.
Right.
And it's hard to make decisions on this if we don't know what our other sources of funding are. So for instance, under the CVRF, if that money could be used for PPE.
It can.
Okay, but if there are other funds from other grant sources, other grant, I don't even know how to refer to this, because I know under the CARES Act, it was broken out in several different types of funding across different agencies and across different efforts. And so the comment was made early on that we'll never spend the CVRF money, all of it. I don't agree with that assessment, because at the time we really didn't know what we could allocate that money for. So what I had asked for wasn't specifically the CVRF guidelines, but it was a chart that showed all of the grants that are coming down through the CARES Act and or other funding that is COVID specific. And so we could do a side-by-side comparison. And then on the CVRF specifically, that is where we are working with and acting as fiscal agent for the municipalities. I think this grant is unique in that regard. I don't think we do that with the other COVID monies. And so we need to be able to have an intelligent discussion with the cities as they start making their requests. And we have no idea, I have no idea what those requests might look like at this point. But as people become more familiar with this, I'm confident that we're going to see requests coming in. And particularly if we have a surge and the governor issues orders that restrict retail businesses or something of that nature, that those businesses may be coming in asking for relief because they may have exhausted their other sources of funding. And specifically in conversations with the Development Resources Group and others, one of the concerns is that loans, in fact, may not help a business that is financially challenged. That's going to come down to grants. And as I understand it, this is the only grant that the county has any control over in terms of how they offer those funds out there. And so I wanted to see a side-by-side to make sure we didn't exhaust our CVRF on things that other grants would pay for. But I haven't seen that matrix.
Well, has there been any additional guidance come out on the CVRF since the beginning guidance? I know that there are several organizations, agencies, whatever, that have spent a bunch of time interpreting what is eligible and how this can be used, but we really I haven't seen any clear, well, I've seen guidance, but I'm not sure it's really clear to me. And I'm not sure if there's anything that's more clear that's come out.
Outside of the payroll one that I sent this morning, they're still trying to work that out. And that is one of the things that DOLA is working tirelessly on, is getting those answers and getting them to us.
So our ineligible expense list, I think, is going to be the most helpful. This funding can allow for a bit of flexibility and creativity at the county level. If there are specific needs that we want to address, what we need to make sure is that they don't fall in the ineligible expenditures. Expenses for state share of Medicaid, damages already covered by insurance, payroll or benefits for employees whose duties have not substantially been dedicated to mitigating or responding to COVID. And that's at our administrative level. That doesn't file down to a business. So that's not something we have to watch if we do a grant to a business. We can't fund for expenditures that have been or will be reimbursed under any federal program. So no double dipping. We can't do reimbursements to donors for donated items, which is never allowable. We can't offer workforce bonuses other than hazard pay or overtime. So we can't do this to just give everybody a little bit of money around the county. We can't offer severance pay through this, and we can't satisfy a legal settlement with this fund. So aside from that, as long as we are falling within the rules, and they gave us this great tree. I don't know if you guys saw this one. I think Trish might have shared it with everybody too. We've got this eligible spending decision tree, which really fits a lot of generally when you're spending federal funds anyway. So this is kind of the rules that you have to follow. It offers a pretty great yes or no follow through the guideline. So if we have an idea, if you guys have an idea, or if the municipalities have an idea on a way that we would spend these funds to address COVID prevention, treatment, or helping with the economic impacts, then we'd need to take it through this. You guys would need to approve that plan, and then we can move forward.
Okay, but back to my original concern. We can, as I understand, we can spend CVRF monies for efforts that may also be funded by other grants. And when we first started having these types of discussions, there was talk about how long it takes to get the money. I believe it was from FEMA, that it could take up to a year to get reimbursed, whereas some of these others are faster. But the decision really has to be made on how do we allocate these funds. So for instance, if FEMA pays for something that CVRF could pay for, it may not be in our community's best interest to use it, exhaust the CVRF money just because we don't want to wait for reimbursement from FEMA. We may have a clear and present need that only CVRF would cover. So I wasn't asking that we make a decision right now. What I was asking that we have a complete comprehensive, or let me say comprehensive, but basically a summary of each of these sources of funding, what is eligible, and I guess you could include there what is not eligible, but we have a pretty good idea of what's not eligible. And then we can compare, and we know based just today on this personal cost tracking that Trish sent out this morning, that the rules are changing as we go. And on that particular instance, it looks like they relaxed the requirements a little bit as far as tracking. Is that what I read correctly in that particular document, Trish?
I think it's more clarification more than anything. And yet from the first training session 3 months ago that I attended, it definitely sounds like it was relaxed at least a little bit. And I would like to remind you that
is guidance from the U.S. Treasury. All state agencies will scale back the time and activity tracking for activities for either FEMA reimbursement costs or CARES funding certain payroll expenses. And so it did provide clarification, but they are relaxing a little bit.
I would like to remind you that the funding for FEMA and CARES Act have the exact same guidance. They're both federal funds. And the FEMA isn't 1 year. It's according to the training that I went on is 3 to 5 years, which does hold true to the fire. That's how long the reimbursements took for that as well. So.
Okay, 3 to 5 year reimbursement window for activities that take place between now and December 31st?
Correct.
Okay. FEMA, the money's
the exact same guidelines.
But perhaps different eligible categories.
They are identical.
I bet they aren't.
And what I'll do is resend you from the summary and notes from that training that I sent. I will go ahead and resend that to you. It's been quite a while.
Okay, well, I don't know if I need it resent. You can if you want to. I just end up with duplicate emails. But I'm going back to my original, I'll call it my request. The other commissioners can agree or disagree. That's up to them. I would like to see a list of all of the available funding sources for COVID-related activities available to the county. So we can compare them side by side so we can make determinations on how we are going to make our request for reimbursement for various activities or purchases. And I have not yet seen that. And I'm not comfortable making it personally any decisions, and I'll go on record as saying that in the appropriate venue, that my request still stands, and that I feel that if we don't do that, we will not be exercising our best due diligence. I know that other counties have done this.
And I'm going to say that some of this guidance is vague. And if DOLA is still interpreting it, then I'm not sure that it is concrete enough to set out a document that says, this is what this one will cover completely. And I'm not sure that we have enough information to say that each one of these grants or this particular grant will cover these items. I think what we have is we have a list of items that it won't cover. And I think the whole grant and the whole intent of the grant, like the CARES Act, I think they put it out there and said, you figure out what your community needs and you use your own creativity. And so I'm not sure that there really is the guidance that says it will cover this or it will cover this. I think it's more about what it won't cover.
Well, that may well be, but we have to use the best available information. And DOLA is not our only people we enact. We're doing stuff through CDPHE. We're doing stuff through FEMA. And I don't know if FEMA/Homeland Security is the same. I don't know. That's what I'm asking for. Somebody tell us what's out there. And we use the best available information and try not to operate off of assumptions to the extent we can. So all I wanted to know is how many of these grants are available out there. And we know some of them. We know some of the eligibility stuff. We know through CDPHE. We know what could have happened with the HCC grant in terms of what they offered us. We weren't able to take full advantage of it. But Tricia's ordering masks, for instance, for the courthouse. What funding source, what grant program are we going to request reimbursement for under that? Is it going to be the CRVF or CVRF? Is it going to be through some other entity?
Yeah, the only two were outside of some public health money that may or may not be coming in. They're also trying to get a grasp for what money is coming into public health. It's not set in stone. They randomly send us money and then we have to sign certification after the fact. So there's a number of funds that can come out of, as well as our own emergency line item that has been budgeted for, and our reserves that was specifically for emergencies.
We understand that, but take, for instance, that grant document that came in the other day. What was that, the ELC or the ELC grant?
That's the one I was just referring to, where they send us money and sign the certification afterwards. And I have a feeling this will continue, that public health directly will keep receiving money. It's not necessarily grants. And then we do have our own regular grants that we are the fiscal agent for that also are allowing PPE purchases. Not to say that's what we would use, but it is still an ongoing trying to figure out what money we are receiving. They did just come up with a website. Tony was showing me. I don't have that link where I'd be staring at it.
I'm trying to find it again.
Where it does look like they're trying to organize some of that stuff. And that was, if memory serves, was the CDC that's putting that stuff together. It's a brand new website.
The CDPHE is doing COVID funding for public health. They've got a website going and I'm struggling to find it right now, but it does exist. I have a link that'll help us do kind of what you're asking for there. I did reach out to Tom to see if he had built something or had some information. Monica.
Tom, who's Tom, Tony?
Tom Monaco, I believe.
Okay, at OEdit. Okay,
yeah.
And that's a totally different organization.
Right, and he said he didn't have anything like you were asking for, so we're gonna keep trying to build it on our own. Like Tricia's saying, different grants are suddenly flexible. They have additional funding that they're going to release. Our EPR released additional funding through a PO that I was finally able to find. Healthcare Coalition just sent us a PO. So they've approved the funds. We invoice back on that. It's not a contract. So those things do just keep coming up, and we've got to figure out as we go.
So what I hear is it's somewhat confusing. Speaking specifically to the Office of Economic Development and International Trade, OEDIT, their funding sources may be entirely different than the ones that we're working with directly right now. So they work with the DRG, Development Resources Group, and Kevin Wilkins, and so they've got a pretty good handle on the economic development monies that are coming down, but not specifically, for instance, as CVRF. That may fall outside of their area of authority. In fact, it does fall outside of their area of authority, but they are in a position to give us advice and expert advice on how best to deploy those money for business and economic purposes.
Yeah, he's happy to come talk to us again, is what he said. If you all do decide that we're going to do business grants, or if there's some project that we want to go forward with, he's happy to come back.
Right. But if they came to us and said, this is a way to use this money and these are some of the needs we're aware of, we would be in a poor position to even make a decision on that, not knowing if we're going to need those CVRF funds for other requests, other expenditures. But if we knew that those other expenditures are covered under a different grant program, then we could make a coherent decision. That's what I'm asking for. So we get a big picture look. I understand it's going to change, and we have no idea what's going to happen with the surge or any of this stuff. We can only speculate, and we don't know what will happen after December 31st. We may be dealing with this 2 years from now, quite frankly, and so what I'm asking for as a real-time snapshot of where we are today. And if DOLA is vague, we just say DOLA is vague. We don't know on that. We don't have to have a complete answer for us to at least start becoming more familiar with how this process is working across the board. It's just basically gathering intelligence, if you will, so we can make decisions if we have to. And so we aren't making ad hoc decisions that we're going to buy PPE and it's going to be paid for out of this particular source of funds. And I'm not talking about dipping into county reserves or any of that at this point. I'm talking about the COVID specific monies that are available to the counties for whatever purpose.
And John, I'm going to say that because it is vague and that it keeps changing, that if you try to do a matrix on that, it's going to change very frequently and possibly give you very limited amounts of information. And I'm thinking that in the list of priorities at this point, that may not be on the highest level.
Quite frankly, I haven't even seen a list of priorities. We just kind of we're reacting instead of anticipating right now. And if that's what the board wishes to do, that's their decision. Gene Glover hasn't weighed in on this. I don't know what he's going to say, but if I hear you correctly, Suzanne, you feel like this is a futile or unimportant effort at this point.
That's kind of my thought, is that those grants are out there and they've got very general guidelines. And I think, okay, within the general guidelines, but it's so general that I'm not sure that that matrix would do any good. And I think we're looking at budget season. We're looking at a lot of other things. And so I really think that having a chart that's going to change regularly as information comes in, I'm not sure that that is the highest level.
So
Okay,
does anybody on the call right now know how many grant sources we have available to the county specifically related to COVID?
I want a chance to weigh in just a second.
Yeah, go ahead, Gene.
So what I'm hearing is we have a list of the things we can't do tentatively. Is that right, Tony?
For the CARES Act to the county specifically, yes.
So if we have a list of the things we can't do, why isn't there some place we can go to get a list of the things we can do, so we know what to do with the different groups of monies that are coming in. Because there's 2 or 3 different pots of money that is enough that we need to be on top of it. And I don't know, I'm not asked this because I don't think anybody's not done their job. I just want to know why we can't get the stuff that tells us how to do it if we got the stuff that tells us how not to do it.
Okay, so for the public health specific funding, that's part of what I'm bringing you on Wednesday for our super long meeting, is looking forward and how do we use those funds to ensure as best we can that we're not going to fall behind or we're not going to be overwhelmed by a surge. So we have enough staffing and we have enough supplies to make sure that we're covering what we need there. For the coronavirus relief fund, and to answer John, right now we have 4 sources of funding specific to COVID through CDPHE coming through public health. So for the coronavirus relief fund, I think what Trish said she just resent to you guys on point 4, it begins to discuss allowable examples. No, I'm sorry, on page 2, it begins to discuss allowable examples, and that goes on to page 3. And these are things that they have anticipated are likely that counties are going to want to spend these funds on, but knowing that counties may come up with different ideas. We may have different priorities. Tourism isn't discussed in here. There are some ideas that may come from different groups in the county that would still be able to use these funds, but aren't explicitly outlined. So using this for food delivery is listed on here. Helping the schools with facilitating distance learning, that's listed on here. There are examples for you if you wanted to start looking at those and then consider how they apply locally. But they don't want to further restrict this funding by saying, Rio Grande County, what's going to be best for you is to just do these business grants. And that's your solution. That's all you're allowed to do. So they're
Okay, Tony, I understand that. Tony, you're a little bit challenged here because you're wearing 2 hats. You're our grants manager for the county, as I understand.
Mhm.
And you're also acting in the public health department.
Right.
I'm assuming that the public health department is going to eat up a large bulk of your time because we're doing things like this, protect our neighbors, regional efforts, and things of that nature. So somebody in the county has to be on top of this, looking at not just the public health component of it, but the economic impact component. And I'm guessing, lacking other staffing, we don't have a Tom Monaco working for us, that it's going to fall to the commissioners. As I understand, Trish is up to her ears and a dozen other things, including the adoption of a new software system, developing a budget for next year, things of that nature. So it may fall to the commissioners to take that kind of higher elevation view of the overall situation, and particularly it's our responsibility at the end of the day, the commissioner's responsibility, to figure out how to allocate these monies. And I think that it would be negligent on our part to just assume that we can't know, so we're not going to ask. And without burdening you or Trish, but I'm assuming that Tony and Trish work together closely, so they probably have conversations that cover kind of across the board. But right now we're focused on the public health component of it, because that's really what's in front of us right this instant, particularly as we try to move towards protect our neighbor and developing these relationships with the other entities. But the other thing that we are responsible for, and I don't know if anybody is clearly on top of it, is how we interact with the cities, the municipalities, specifically under the CVRF grant. Now, we can look at the CVRF grant by itself, but because we can cover the eligible expenses that other grants may cover or are covering, that we know are covering, particularly the public health side, which would include things like PPE or whatever else we're doing, Social services side on food delivery, if they're even being tasked with that at this point. And I don't want to go into details on any of these, but there's too many things out there that probably aren't coming across your desk, Tony, in a way that you have to deal with it. You probably see it, floats by, but you're focused on something else at the time. You've got a lot going on. Just looking at the DOC meeting notes this morning, there's a lot of stuff that you're having to do just in the day-to-day management of the health department, from what I can tell. The contact tracing and how you allocate resources. So somebody needs to take a look at all of this, but somebody has to get us the information. And any one of the commissioners could make all the phone calls and send all the emails to all these different agencies, state and federal, to find out if that's what we need to do. But I'm assuming that information's flowing through the county as it is. It's just that we may or may not be seeing it in a coherent fashion to make rational decisions. I don't know yet, but I am confident that as this goes forward, we're going to be getting requests for things that we have not anticipated, but we could anticipate them. And we don't have to spend a lot of your time or Tricia's time. I'm asking for a simple, like you said, there are 4 CDPHE funding grants right now. We know there's a CVRF. I don't know about FEMA or anything else. I don't have a list. And that's what I'm asking for. Gene, do you concur with that at all?
I do. I think it's something we definitely could work on. I definitely don't have a problem coming up and help do something. If somebody wants me to help follow up or whatever, I'll come in and make phone calls and sit down with Tony or Trish, either one, and do whatever I can on my end. So if that's all we want to do, I'll be glad to help whatever we can. I just know that every time you look on the state website or you try to call somebody up there, they have the same answers we have. There is no answer definitive for anything that we've seen so far. So we've got to find out what they're going to allow us to do, and we need to do that as a team. So I'll be glad to do my end of it. So
thank you, Gene. So yes, Trish.
I just wanted to clarify. So, as far as the funding that we have in hand, not to say that there may or may not be more, but the funding we have in hand is CARES, FEMA, and then sounds like we have 4 public health. I think there's at least one new one I'm not aware of or not familiar. So that would be 6 sources total. And we're still waiting for more information.
But CARES is a generic term for several funding efforts. There's not just one CARES grant.
Right.
From the state received, I forget, $2 billion or something under the CARES Act. And out of that, they allocated to the counties a certain percentage based on population and put some requirements on it. But that's only one part of the CARES Act that was filtered by the state. But there are other funding sources, whether it's going through OEDIT, through the DRG, or other entities. We don't know all of those. I don't expect us to know all of them right now, but we can start filling in the gaps. But when we just refer to CARES Act money, that's so non-descriptive that we might be making mistakes. Or we might.
When I'm referring to it, I mean that $960,000, just so
and
you
that
know.
is the CVRF fund.
Correct.
That is a specific name. That's the term we ought to use for that money, and not include a generic CARES Act. That's about as definitive as just saying federal money or state money. But they all have certain requirements and certain eligibilities. And Tony, while we're on the subject, the grant that we were dealing with last Wednesday, is it the ELC grant? Is that the name of it?
You're not gonna like it, but that's actually the CARES Act through CDPHE for public health specifically. There's no other name for that. That's what
What's the ELC mean? What does ELC mean?
That is our enhancing detection, epidemiology and laboratory capacity enhancing detection grant.
So it comes out of the big bucket, but it is specifically designated for certain purposes.
ELC doesn't look like it came through the CARES Act for public health.
You said it was CARES Act money.
Nope, those are 2 different things. So we've got the CARES Act funding. That's where we already received about 20,000 of it. We signed that letter, we're gonna receive another about 20,000. for that.
That's is that the ELC grant?
It is not.
Okay, so that's a separate
CARES
grant.
Act. That's all they're calling it. That's public health cares.
But it is ELC for specific purposes. Is
Yeah.
that one of the 4 grants you referred to under CDPHE?
ELC and CARES are separate, and yes, we have public health, the environmental preparedness, we have that one. We didn't apply for a second one of those, so we don't have it. We have the CARES Act, which is about $40,000 for us. We have an immunization grant. And then we have the ELC, which is going to be that $300,000 one. So it's separate from what we have.
300,000?
Yes, over
Okay,
3
but
years.
that's coming through CDPHE.
Correct. All of
So
these.
that's one of the 4 you listed under CDPHE for COVID response.
Yes.
Okay, so that is what was it we were looking at Wednesday?
CARES Act.
But what part of CARES Act?
That's all they're calling it. It was CARES Act funding going to public health agencies in the state.
Okay. Now, when I read the document and we had this conversation, I don't know if the commissioners are aware of it. When I went in to sign all the things that had to put a signature on Wednesday, I read through this particular grant that we had already received 20-some thousand, just unasked for, just got it deposited.
Mhm.
And as I read through it, the language in the grant sounded education specific. It talked about mental health help for kids that are in the schools struggling with COVID stuff and other things. And so I didn't sign it at that time while Tony sought clarification from CDPHE. As I understand, she got the clarification and that she was going to use my electronic signature on that after she received the clarification. In fact, that was money that was supposed to come to the county.
Yes.
And then that happened on July 15th, and July 15th at midnight was the deadline for submitting that. And I don't think we were able to do that because she hadn't gotten full clarification by that deadline. But as I understand, Tony, you did submit that the following day.
It is submitted and it has been approved, and they have our check being issued on 7/17. So we should get the other half of that, which will be 20,953.
In addition to the 20-something we had already received.
Yeah.
Okay, so we're receiving 40,000 plus under that particular program, and
Yep.
that money is going directly to public health.
It is.
Okay, and there, I assume certain eligibilities, things you can use it for in public health. As I understood, it was fairly broad categories.
This one is, it's going to be necessary expenditures incurred due to the public health emergency. And there are some requirements for staffing. It's similar to what you've seen with the others, is that we can only use this money for staff who have changed their job description or have been brought on for their job. We can pay for some of the cleaning supplies, some of our supplies, public health specific, through this one.
Right. But that's just, that was kind of windfall or waterfall money that came in. We didn't expect it. It just kind of showed up.
I don't know what the conversations were before this money came out. I don't know what anybody might have agreed to. This is the one that it was the day that the letter was due that I found out it existed. So to me, it was a nice surprise, but I don't know what the state.
Yeah, you don't know what how that originated or what conversations previous health director talking. Okay, the ELC grant.
Yeah.
What'd you say? How much did you say that is?
That's going to be 300,000 over 3 years.
Over 3 years.
Mhm.
Is that specifically designated for public health?
It is. It's for the public health response.
Okay, and that was money that originally we hadn't anticipated. It wasn't in our budget. It's
Yeah.
new money.
All of this is specific to the emergency.
Okay, and so have we applied for the ELC grant or have we been given the grant?
I believe that we are up there. Have been awarded the ELC grant. But this is another one that we didn't have to do a standard grant application.
Okay, so we have this money coming in that's eligible to be over 3 years
Mhm.
spent for specific purposes.
Yes,
And I'm assuming, I'm going to make an assumption here, having not heard any different, that could be used for staff costs, other efforts. So
Yeah.
we have a $40,000 grant that can be used for staff and a $300,000 grant that could be used for additional staff or people whose duties have changed.
right. And that's 100,000 a year, remember, because that kind
Right.
of
It's over 3 years.
on us.
Okay. And so if we were to say hire more nurses,
Mhm.
potentially that could be paid for out of these funds.
Yes.
Okay. Now, when Paul Wirtz was talking to us the other day, I understood that the regional group was trying to request part of a $330,000 grant. And then further into the conversation, when we talked about how to pay for the new nurses and all the people that he wanted to hire,
Mhm.
and we agreed that we would work with him on that and all his other requests in that meeting.
Mhm.
He mentioned again 330,000, and I never got clarification if that was the same pot of money that regional was trying to tap as well as Rio Grande County.
Okay. So the regional effort, they don't have any specific requests that we take it from this pot or another pot. What is happening is they've created a funding formula that is based on the population. And because the Alamosa went ahead and applied for that $50,000 planning grant that was attached to protect our neighbors,
Yes.
they are using those funds to help to offset those costs. Rio Grande County is now being asked to contribute $5,021.
And that would potentially come out of this $300,000 ELC grant.
It could come out of that. It could also come out of the 40,000.
Right. Okay. So regional needs funding, particularly if we go to protect our neighbor and regional picks up more responsibility, epidemiology, whatever.
Yes.
And they're going to ask the counties to take some of potentially this grant money we've received and allocate a portion of that to that regional effort.
Right.
Okay. It's an ask. It's not mandated, but reasonably, if they're going to have to hire more staff to work on our behalf.
Right.
Okay. So we have $340,000 of monies. Well, let's just say 140,000 this year and 100,000 for next year and the following year available to help fund public health efforts in our county.
Right.
Specifically for this emergency response. And so if we needed to hire a nurse or other staffing or whatever is required for us to function efficiently and well, we do have funding available to us.
Right.
That is currently not in our budget.
Right.
Okay. So we're going to obviously need from you, from the public health side, a clear understanding of what it is your office needs to do what it needs to do.
Right.
Staff or whatever. And you'll be prepared to talk to us about that. I'm assuming you're kind of preparing for Wednesday. Is that part of the Wednesday discussion?
It is. Yeah.
Okay.
We need to bring some of the hiring options and staffing options that'll fit into this, and then materials and some of the things that we need to support on the county. So the mask order and some of the cleaning, that kind of stuff that is really, it's coming back to COVID. We're going to make a plan to absorb some of that. Okay.
Do the other commissioners have questions on these topics?
Yes, I do. On the 15th, if I understand this correctly, we had a meeting and we approved the signing of that CARES Act, the $20,000. And John, you went in and you wouldn't sign it because you had a question, but it was due that day. I'm not sure you have the authority to not sign it because you have a question.
It wasn't that I had a question. The document I was asked to sign did not comport with the information that was provided to us in the commissioners meeting. Therefore, I could not sign it. Okay, that's why I asked Tony. Tony even had some questions and agreed that it was somewhat confusing. And so I asked her for clarification, but she had just, as I understand it, that day before on the 14th, had gotten this. She went to a link on that grant document, and what came up was something that only talked about schools, not county. So my question was, what is this grant for? And is it part of a larger program? And maybe there's a specific county document. But the way it was structured, there was no place for a commissioner to even sign it. If you were to look at the signature page, it talked about executive officers, it talked about all sorts of things. So it was a prudent and rational question. Had we seen the document at the meeting, then we could have asked those questions then, but Tony didn't even have that stuff available. She just basically came in and gave us a briefing on it. And it was not, what I saw was not what I understood the program to be. And I didn't have time to do anything other than say, I cannot put my name on this without knowing what I'm signing. Okay. So no, you didn't authorize me to sign that document. You authorized me to sign a document that did not resemble what was presented to me. And I'm not blaming Tony for this. She had what she had. But there was clearly a question. If you read her emails, she asked for clarification. Okay. The fact that she couldn't get a hold of anybody is not her fault. She tried. And we got approved. But that's the reason I didn't sign it. But I said, if in fact this program, we are eligible to receive these funds, she was authorized to use my electronic signature to complete the document. So if any commissioner had signed that as it set at that time, they would have been acting irresponsibly.
And I think we should have probably heard about that at the time, so we could also see the document and see what was going on.
Well, you weren't in the office. I'm sorry.
I did.
And I was waiting for
send that out the night
information from
before.
Tony. It was as simple as that. It wasn't none of these where you get on the phone and wait a half hour on the phone. I had to make a decision right then, and I gave authorization because further, that document was structured only for an electronic signature anyhow. Okay. And so Tony, am I correct in what I'm saying? I'm not trying to throw you under the bus at all.
No, you're fine. I'm not worried about it. But I did send it out the night before. I think we do want to make it a priority for the Board of Health, for public health, that when we're sending that, I want to give you more time. Those addenda were attached to the letter that I sent you out the night before, but that didn't give you a lot of time to read it. And what was explained to me was that it was a standard addenda that they attached, because for the school spending, they ended up needing more explanation. So they attached that to all of the certification letters. But the public health spending, we're able to use those funds for public health.
And that's fine. And it went through okay. But we have a history in this county of signing documents that we haven't read, only to have it come back and haunt us. And there were 3 documents that I had questions on that day. One of them had to do with a date. Tony answered that question. It was good to go. I wanted to make sure we had the right date on it. The other was the accounts payable. And the third was this document that we're referring to right now, this grant. And it was resolved. And I gave her my authority to use the electronic signature specifically on that, when she had her comfort level that yes, that this grant was appropriate. But at the time Tony and I were talking about it, she wasn't sure. At least she couldn't give me a definitive answer without talking to CZPHE to make sure. That's all I asked for. And I consider that to just be due diligence. And she didn't have time to deal with it. It hit her what, the day before, Tony, and it had to be signed the next day.
Yeah, I wasn't aware of it.
Mm-hmm. So that was my authority to answer your question, Suzanne. Anything else on this? If not, we'll move on to the general public health discussion. Is there anything we haven't covered yet? I have some questions based on today's DOC meeting, but is there anything else you have for us, Trish or Tony?
I'd say that we're at 7 active cases. Our Cedars reporting is very slow, so getting the information through the official channel is difficult. So the hospitals report their positives. Any testing facility will report their positives to Cedars, the statewide system.
What is Cedars specifically?
I don't know what it breaks down to. It's the database that holds all of our.
Okay, that's fine. If something comes from the state though, is that
Yeah.
correct?
Yeah.
Okay.
So the information that's been coming through Cedars it's really held up. It's showing us, I believe, at 3 when we're at 7 right now, 7 positive and active cases. So that's a little bit of a challenge, and I think the data process going forward is going to continue to be challenging. For a while, there was evidently a hire up at the state. They hired someone who's gonna whose work is supposed to help this process along. So we'll see how that goes. But just so you guys know, there will be some discrepancy between what is listed on that official database and what we're actually dealing with.
So you know at the public health level what our real time situation is in the county.
Yeah, the hospitals and the testing centers are communicating with public health directly.
Okay, so you can provide us better information in a more timely fashion with the understanding that it hasn't gone through Cedars yet.
Right.
Okay. Good.
And
That
those are
answered the
numbers we're
question. I'm sorry?
Those are the numbers that we're using when we're reporting out as well. We're using our known numbers rather than waiting for Cedars.
Thank you. Thank you. Anybody else have any questions on the public health side?
I don't. I'm good with it right now. Thanks.
No,
All right. Then I have a question about tomorrow's meeting with Dennis Hunt. Is this going to be in person or remote?
In person is what I think was said. So I can confirm
Okay.
that, but yes.
Okay.
I
I know he's
can
coming
ask that.
down. He's driving. What time is this supposed to take place? I haven't seen a time yet. I just saw afternoon.
Yeah, so I emailed this weekend, 12 noon, and put it on the calendar.
So it is on the calendar?
Mm-hmm.
Okay, so I see it on the calendar now. I didn't see it earlier. Okay, so Dennis Hunt will be here at 12 noon. I know he called each of the commissioners to see if we concurred with having that meeting because I don't know, did we request that meeting as commissioners or was it just offered to us? Okay. He was making that distinction in the call I had. We had a fairly lengthy call. I don't know if you guys did or not. Okay. How are we? Oh, I do have a public health question. How are we doing in the potential COVID exposures within the county employees?
So far, anybody who's reached out, we're using the same recommendations that we use with everyone else. And having them stay home, we haven't heard of any additional positives.
Okay, so that is all being handled right now. Okay. Hopefully Ryan and I will be available at noon on Tuesday. We have other commitments that morning and hopefully we'll be able to be there by noon. I haven't spoken with Ryan since all this came out, so I don't know. Is there anything else for this work session?
not that I know of.
Okay. Suzanne, are you satisfied with my answer on my signature? On the grant?
I'll accept it for now.
Okay. Gene, do you have trouble with it?
Nope, I'm good.
Okay. All right. Is there anything else for the good of the order? Hearing none, how about if we call it a day?
Sounds good to me.